Hi guys, welcome back to NEETSPIRE, a space where I try to break things down in a simpler and interesting manner to you. This is Dr. Farkanda Sophie, and I've started this series of short videos in which I try to explain a bit difficult topics to you in an easier manner. So, with all that being said, let's start with today's topic, which is cardiac cycle. The moment you listen about cardiac cycle, something goes down and you think that it is a horror story or something like that. But today's objective would be that after watching this video, your concepts regarding cardiac cycle should be very, very clear and you should be able to answer almost all of the questions regarding this topic. So let's get started. But before I tell you about the cardiac cycle, you should know about the conduction system of the heart. Okay? So, a brief about the conduction system. Look, this here is the SA node, which is the pacemaker of the heart. Okay, what is a pacemaker? The pacemaker means that it is a structure that generates current or action potential, we call it, for heart to contract. Okay, so this is the pacemaker of the heart. This is the point from where the current is generated so as to enable the heart to contract. Okay, now from the SA node, the current travels through these internodal pathways to the AV node. Okay, from the AV node, it goes via the bundle of His. This is called the bundle of His. Okay, this is a common bundle. Then divides into two left bundle branch and the right bundle branch. And these bundle branches in turn divide into little fibers which are known as Purkinje fibers. Okay, this is the conduction system of heart. Nothing difficult. It just starts from the SA node, travels towards the AV node through these internodal pathways, and then goes down through the septum. This is the interventricular septum. Okay, through the septum it goes down via the bundle of His, then divides into two branches for right and left ventricle, which are known as left bundle branch and the right bundle branch, and then these bundle branches divide into the Purkinje fibers. Okay, so this is the conduction system of heart. Now, to understand the mechanism of working of heart, that is the cardiac cycle, we need to understand a basic structure and basic physiology of the heart. So for that, we'll quickly go through the basic structure of the heart. So you know this is the right atrium, this is the left atrium, this is the left ventricle, this is the right ventricle. These are the veins, the inferior vena cava and the superior vena cava, which bring blood to the right atrium. And the conventional direction of the blood is the blood comes into the right atrium, goes into the right ventricle, then through the pulmonary arteries, goes to the lungs, comes back through the pulmonary veins into the left atrium, goes into the left ventricle, and via the aorta is distributed throughout whole of the body. Okay, so this is the basic structure of the heart. Now talking about the cardiac cycle. Look, it's very easy. The cardiac cycle starts from a phase in which all the four chambers of the heart are in a relaxed state. So this is known as joint diastole. The atria and the ventricles are in a relaxed state. No doubt that the blood from the atria is coming down into the ventricles, but it is a passive movement of blood. Okay, they are in a relaxed state. There is no contraction happening whatsoever. Okay, so this is a joint diastole. Now moving ahead, the blood that comes from the atria to the ventricles in this phase is almost 70%. Okay, 70% of the blood is transferred. Now the remaining 30%, what about that? See, here you can see that the atria now are contracting. The right atrium is contracting, the left atrium is contracting, so as to push the remaining 30% of the blood into the ventricles. Okay, so this is atrial systole and it pushes 30% of the blood from the atria to the ventricles. Okay, this is the second phase of atrial systole. Now till here you know that these valves, the tricuspid and the mitral valves, are open. Okay, obviously that is why the blood is being transferred from the atria to the ventricles, right? These valves were open. Now all the blood has been accumulated in the ventricles, the pressure inside the ventricles has started rising, and the blood needs to go out of the ventricles through their respective channels. Okay, for that to happen, the tricuspid and the mitral valve need to close, right? So now what happens is these two valves close. Okay, and the ventricles start contracting. Okay, see, these are contracting and they are pushing the blood through their respective channels. How will they push the blood through their respective channels? Only if the valves are open, the semilunar valves, the valve of the pulmonary artery and the aorta. So these valves open and the blood is pushed through the pulmonary artery to the lungs and through the aorta to the rest of the body. Okay? This phase was ventricular systole. Now ventricles have contracted, the blood has been pushed out. Now the ventricles need to relax in order to again get blood from the atria and repeat the cycle. Okay, so for that these valves need to be closed now, right? So that the blood doesn't go out. Because first we need the proper filling of the ventricles so as to increase the pressure in the ventricles to a level that the ventricles can contract and push the blood out. Okay, so for that to happen, the semilunar valves need to be closed. Okay, now these valves close and again the tricuspid and the mitral valves open and the atria start pouring down blood into the ventricles, and again heart goes into the phase of diastole. That is, all the four chambers of the heart are in the relaxed state. So this is how your cardiac cycle works. It is very, very simple. Okay, now if we relate this to the conduction system that we studied earlier, so what happens? SA node somewhere here will generate a current which will force the atria to contract and which is called atrial depolarization. Okay, I'll show you all of this in the ECG ahead. So this is the atrial depolarization. Then what happens? Now the impulse has traveled to the AV node and via the bundle of His to the right and the left ventricle. Then comes this stage, the right and the left ventricular contraction, that is the ventricular systole. So now you understand how the conduction system of the heart is responsible for generating action potentials or force in the heart to contract, and the blood is being sent to the respective parts. Now, a bit about the duration of the cardiac cycle. See, the duration of all of these phases, the duration of cardiac cycle is approximately 0.8 seconds. Okay. Now, another concept that you need to know is the formula cardiac output is equal to stroke volume into heart rate. Now see, what is a stroke volume? Stroke volume is nothing but the amount of blood that is pumped out, in each cardiac cycle. Okay? In each cardiac cycle. In every cardiac cycle, the amount of blood pumped out is approximately equal to 70 ml. Okay, the stroke volume is approximately equal to 70 ml. So what is our cardiac output? Cardiac output is equal to stroke volume into heart rate. Stroke volume, I told you, is 70. Heart rate, we take approximately 72, and this comes out to be approximately 5000 ml or 5 liters. So 5 liters of blood are pumped out by the heart in 1 minute. Okay, that is known as the cardiac output. Now let's apply all of the information that we have studied till now on the ECG. Now see, on ECG, the pattern that we get is somewhat like this. Okay, so this we call the P wave, this is the QRS complex, and this is the T wave. As I told you, starting from this is the atrial systole, and the P wave is generated because of the atrial systole. So this is the atrial depolarization. Why depolarization and why not systole? Systole is the muscular activity, the contraction, but ECG is the study of the electrical activity. Okay, so firstly, atria have to depolarize in order to contract. Then the QRS denotes ventricular depolarization, which will in turn cause ventricular systole. The ventricular depolarization will cause the ventricular systole, and this T wave is a repolarization wave. Okay, the relaxation wave, the repolarization of the ventricles and the atria, which I told you is the joint diastole. I hope it is very clear. There's nothing to be confused about. The P wave stands for atrial depolarization, which in turn will cause atria to contract, and we call it atrial systole. Then the ventricles have to contract, so a QRS complex is generated for the ventricular depolarization. Then all of the chambers have to relax, so this is a repolarization T wave, which causes the ventricular and the atrial relaxation, which is called the joint diastole. Okay, so let's talk finally a bit about the heart sounds. Okay, all of you know that we have two heart sounds. First one is lub and the second one we call dub. Okay, now look, if we plot these sounds, on the x-axis is the time and on the y-axis will be the intensity. This is just to make you remember the things. Okay, see, it comes out to be something like this. Now what do you understand? It's simple. The first heart sound has a prolonged duration but low intensity, whereas the second heart sound has less duration but high intensity. Okay, high pitch. So this you have to remember. Now what causes these heart sounds? Okay, the first heart sound is caused by the closure of AV valves. I told you first AV valves have to close, and second heart sound is caused by the closure of semilunar valves. Okay, this is common sense. This is understood that a sound is going to be produced only when the valves will be closing, right? Because the closure will be forceful and will generate a sound. Now, which valve closure you know? Firstly, the AV valves close, so the first heart sound, and then the semilunar valves close, so the second heart sound. This is also very simple. You don't have to mug up anything. Now, when do AV valves close? They close at the beginning of ventricular systole, because once the AV valves close, then only the ventricles contract. So, at the beginning of ventricular systole, first heart sound is heard. Whereas, when do semilunar valves close? They close at the beginning of ventricular diastole. When the semilunar valves close, then the ventricles relax. So, at the beginning of ventricular diastole. Okay, so this brings us towards the end of the video. So what we studied today were the heart sounds, the conduction system of the heart, and the cardiac cycle. I hope it is very, very clear to you and you'll be able to answer the questions now. So thank you so much for watching the video. And if you find these videos helpful, kindly consider subscribing to my channel. See you in the next video. Till then, keep studying.